I'm going to give it a couple more seconds here for folks to join, but we're going to go ahead and just kick it off because we don't have too much time. Thank you all for joining today and inviting me to join all of you, actually. My name is Philippe Nassif, and I'm the Advocacy Director for the Middle East and North Africa here at Amnesty International USA. So I am based here in Washington, D.C., and I work on our government relations team. So Joanne, who was on the call earlier and is in the other breakout room, manages our government relations team here at Amnesty USA. So that's the team of people that are broken up by regions around the world and handle all of the advocacy with the United States government. So that means, anything, as she sort of explained, that has to deal with the White House, that has to deal with Congress or the State Department, falls into our team to handle. A little bit more about what we do on the Middle East North Africa desk specifically, and then I'm going to jump right into the two big issues that I've been asked to sort of discuss today, which is human rights in the age of COVID, and specifically how that's impacted our work in the Middle East and North Africa. And then I'm going to talk about the conflict in Yemen, and the crisis in Yemen, which is a huge part of my work, at least since I've been in this job over the last 2.5 years. So a little bit about the Middle East North Africa team. We've got myself here at Amnesty USA. Amnesty International is headquartered in London. That's the international hub of the entire organization. But the folks I talk to the most within the organization are those that are in our Beirut office. So that's basically our hub for the entire region, based in Beirut, Lebanon. And then we have an office in Jerusalem and an entire section in Israel, in Tel Aviv, based in Tel Aviv. And then we have one in Morocco. And then we have an office in Tunis. So the Israeli, Amnesty Israel, Amnesty Morocco are sections like the United States. So they all have members essentially that go lobby their parliamentarians or whatever form of government exists, and try to change foreign policy and domestic policy within their respective countries. It's a little harder in Morocco than Israel, but in a sense, those are the only two areas where you can really sort of openly sort of lobby, and there's a process in place for that to happen in Israel and Morocco. Our office is based in Beirut because we got kicked out of the majority of the other countries in the region. We're not allowed to operate on the ground in the Gulf. People ask, well, you're not in Dubai. Well, we can't be there because the UAE is a big human rights violator, and we'll talk a little bit about that. And so they don't really want organizations like us to be present. So it sort of gives a snapshot of the folks that feed me the information that comes from the region. These are the people that go into conflict zones and collect evidence of war crimes that have been committed and talk to victims. They sometimes are able to show up to a court hearing where a dissident is being or an activist is being put on trial, and in a sense they're there to sort of verify that the legal system is functioning, which most of the time it isn't generally in my region. However the case, it's important for us to be present. So having said all of that, I want to talk about these two sort of big issues, and then I think I'm going to leave plenty of time for conversation and dialogue with all of you, because I love talking to groups of students and other academics, and I think that the best way to learn is really to sort of engage in a conversation to the extent that folks are willing or wanting to do that. So we'll give that a shot as well. So right off the bat, we are, as we all know and are reminded of every day, living in this pandemic. Joanne was talking a little bit about just how horrible it's been here in the United States. However, we don't really have a sense of truly how terrible of a toll it has taken on many of the countries that I work on in the Middle East and North Africa. And here are some of the reasons why. first and foremost, if you've got a country like Syria or Libya or Yemen that are completely war-torn, that have had governments, in the case of Syria, and to a certain extent in Yemen, where the Saudis and the UAE have been bombing healthcare facilities deliberately at times, which is a war crime, by the way. In Syria, you have a government, the government of Bashar al-Assad, that has deliberately targeted hospitals, infrastructure that is both crucial for a functioning society, water treatment facilities, waste treatment plants, power plants, all of those things, but also hospitals and clinics, systematically over years. So you had this horrible war break out in Syria. You have half of the population. So the top population is about 22 to 24 million people. Half of that has fled the country or has been internally displaced. And you have almost 500,000 of people that have been killed in Syria alone. So when you have a country like Syria that is so broken, and you have a pandemic, you have no idea really how bad it is spreading in the population. We have a sense in some areas where there are refugee camps where organizations are on the ground and able to operate. But in most cases, the Syrian government does not want people to be present and in a sense, assisting populations. And so because of that, we don't really get a sense of how many people are actually dying of the disease, of the virus, how people are sick. We know there aren't the hospitals that are in place to sort of take care of people. So ventilators is the last thing on everybody else's mind, and more basic, how many people are sick? We don't even have those numbers, you know. And what the Syrian government put out, where they said there was only 25 cases, you know, 3 months ago, we know is absolutely ridiculous on every level. So again, we have a part of the world where information is often not disseminated, certainly democratically, certainly in a very, very transparent way. And so you have to sort of estimate and guess, or find out from people who are fleeing the country. And what we do know is that the situation in Syria is very bad. We don't know how many people have died of the virus. We do know that a lot of people are sick. And we do know that they're, you know, by satellite imagery, we're seeing mass graves that have been dug up and burying people. And those aren't people that have been killed in conflict. These are in areas where there isn't really active conflict in Syria taking place right now, in some government-controlled areas. So we know it's really, really bad. We know that in Yemen, you have a similar situation. We've seen satellite imagery of mass graves that have been dug up. We have no idea, again, as to how many people are being killed. There's a little bit more of a presence of aid organizations on the ground in Yemen that can kind of feed some of this information to us. But you also have a famine that has been occurring in Yemen before the pandemic hit. So you have now war, pandemic, and famine all at the same time. So, you know, the list of issues that Yemen in particular is facing is long and very bleak. So, you know, looking a little bit further out of those two conflict hotspots, Yemen and Syria, let's talk about Saudi Arabia, let's talk about Egypt, let's talk about Lebanon. All of these countries, to varying degrees, Lebanon's been quite transparent with the number of cases it has. They've gone through multiple rounds of shutdowns where they've shut the whole country down and then reopened. Israel's done the same. Saudi Arabia has to a certain extent, Egypt sort of, but with the Saudis, with the Egyptians, with some other North African countries, they're not being very forthcoming in the number of cases that exist. They're not being forthcoming on how bad the virus is spreading, and they're not being honest in terms of the impact that it's having on the population. You know, in Egypt, we've been so concerned about the prison population because Amnesty has called Egypt the largest open-air prison for critics, where thousands and thousands of people have been arrested and thrown in prison because they are simply suspected of being a part of some sort of opposition movement or the Muslim Brotherhood, which the current strong leader of Egypt, strongman, President Sisi, led a counter-revolution to overthrow the previous government that was installed by a revolution. That he has been, in a sense, he's implemented this horrible policy of just mass arrests and killings in some cases and throwing people in jail. So you have these overcrowded prisons in Syria and Egypt and other countries where the virus is exploding too. And we have no idea the impact it's having. So I'm sort of trying to give you all a sense of the fact that, you know, the Amnesty exists to document human rights abuses. We exist to document war crimes that are being committed. We report those specific issues to the US government, and my job essentially is to find an opening for the United States to assert its influence and change a dynamic that's happening on the ground in a country. And we often do that by having people like all of you lobby their members of Congress and put pressure on them to take action. And then the other way we do that is we just put pressure on the White House, whoever's in office, and the State Department, whoever's Secretary of State, and all of the desk officers that work under them to take action as well and back channel with some of these governments. So on a normal day, we're worrying about protesters being shot, journalists being killed or arrested, and now there's all of those concerns that have really multiplied under the Trump administration. And now you add to the fact that you have a virus on top of all of it. So I'm trying to give you a sense of sort of the day-to-day and how much things have changed because of the pandemic and the impact it's having on the region. Switching to Yemen, because this is something that I want folks to sort of leave with a very firm understanding of exactly what's going on in that country. Crash course in very quick history. Yemen was one of the countries that rose up during the Arab Spring. So in 2011, you all probably have likely seen or heard of the series of revolutions that swept the Middle East or North Africa. It started in Tunisia, and you can almost geographically look at how it started in North Africa and just kind of went east to different countries. It's a knock-on effect: Libya, Egypt, Syria, Yemen, etc. You had all of these like uprisings that broke out, and they were partly rooted in economic grievances, but mainly in a lack of freedom of expression, a freedom of movement, lack of freedom of association, basic human rights needs, right to access to water, to food, etc., healthy economy. All of these things are sort of human rights issues. Lack to access to the healthcare system. This is what caused these revolutions to occur. So you saw them sweep from North Africa into the Middle East. Yemen was one of those countries that actually overthrew their longtime leader relatively peacefully. And academics and experts spent about 6 to 8 months, almost a year after that successful revolution, talking about how Yemen is a model for the region, that it was able to get rid of its government and stabilize itself. What happened is that you ran into the classic example of popular uprising, overthrows longtime leader, and all of the institutions that were built around that leader. And then there's a power vacuum, right? And this is what happened in Iraq after Saddam Hussein was toppled to a certain extent, right? Where you had these institutions, however bad they were, that were demolished because they went with the longtime leader of that country. And you have, in a sense, a sort of chaos. So, I'm not making an argument that people shouldn't revolt and overthrow their governments, because people are going to do what they want. And I think at the end of the day, what happened in that part of the world and what's happening again, because there's a second wave of uprisings that have been sweeping the region since last year, it's a positive thing because the seal of fear is broken and people feel like they can speak out and take action. However, this chaos can occur, and Yemen quickly descended into civil war. And the United Arab Emirates, Saudi Arabia, specifically Saudi Arabia, got involved because there is a armed group called the Houthis in Yemen who have some ties to Iran, however small or big. And the Saudi foreign policy is really quite focused on just countering Iran in the region. And so oftentimes the Saudis and the Iranians will sort of duke it out in various areas of conflict in the region, whether that be in Syria, or to a certain extent in Lebanon, in Libya, and obviously in Yemen. And so you had the civil war break out. Long story short, no healthcare system already in place, poor healthcare system, poor education system, poor infrastructure. All of that was demolished in the first several years of a ferocious aerial campaign led by the United Arab Emirates and Saudi Arabia using US-made weapons. The United States sells billions and billions of dollars of weaponry to Saudi Arabia and to the United Arab Emirates. This week, there was an announcement that $24 billion in arms sales is going to be pushed through to the UAE, in addition to all of the other billions of arms sales that have gone through under the Trump administration and under Obama before and under Bush before that. So it doesn't really matter who's in office. This has been a consistent pattern of selling weapons to these countries and not really worrying about what is being done with these weapons. So I'm going to drop something in the chat here. But basically, Amnesty found out that the United Arab Emirates has essentially been dumping weapons, sometimes US-made weapons, into Yemen, sort of in a sloppy fashion, where they're just like, oh, we have, several crates of grenades and ammunition and like light weaponry. We're going to hand them off to some Yemeni militias that are fighting on our behalf, and just sort of like turn the other way. As long as they're fighting for our cause in Yemen to get rid of the Houthis, it doesn't matter. Well, turns out war crimes were committed with those weapons. Half of them fell into the hands of Al-Qaeda. So that's not good. And, the US military and the US government is like, how the heck did Al-Qaeda get a hold of the weapons that we sold to these countries? And it turns out, with an investigation that was led in part by us, and this story was broke by CNN, and I'm going to type this here so you guys can see this site, because I think it's really cool. We found out that the UAE was dumping these weapons into an active conflict zone, and war crimes were committed. Civilians were killed. Civilians were massacred. Bad things happened. And so, when we talk about the safeguards that are in place, when the United States sells weapons to another country, this is what it's supposed to prevent. It's supposed to prevent this. So not only are we just arming these Gulf countries, but we seem to turn the other way when this kind of bad stuff happens. Another example, a precision-guided, laser-guided missile was used by the Saudi Air Force. What looks to have been a deliberate strike on a school bus filled with children. This was a couple years ago. They killed over 12 little kids going to school. And Amnesty was able to go in to the site of the airstrike, take fragments of the weapons that were left behind, of the bomb rather, that was left behind the missile, found a serial number and matched it to a Raytheon manufacturing facility in Arizona. So like, there is no way to hide, the complicity in a war crime like that. And, when you look at, and there's a lot, you can Google about what happened to the school bus. And it's not the first time a school bus or a school was struck deliberately by the Saudi Air Force. But, there had to have been a calculation. It's not like a plane is flying, around randomly and just dropping dropping missiles. Like this is an advanced system. And you can zero in and see what your target is. And you can precisely target, a red car down the street versus a green car parked 4 cars up. I mean, it's like very precise, generally speaking. So the fact that they hit something in a civilian area, which to begin with, there's no military targets around. So like, obviously they're already seeking malintent, which is in and of itself a war crime, but then they hit the school bus. So have a look and sort of see a little bit about that story. It's a snapshot of what's been happening repeatedly in Yemen for a long time. This website is very directly related, this When Arms Go Astray report that we put out is very directly related to what we have taking place today, the arguments to push back against UAE arms sales. It's because of stuff like this, because of weapons being dumped in Yemen, because the conflict is continuing. Now, I've talked about a lot of arms sales, and I'm gonna stop talking in a couple minutes, but a final point here is the Saudi and the UAE, because they have aerial dominance, and if you know where Yemen is located, it's at the foot of the Arabian Peninsula. It's surrounded by water on 2 sides. You have the Red Sea and the Arabian Sea and the Indian Ocean, really. They implemented a blockade. So the Saudi warships, UAE warships, in a sense, blockaded Yemen and sealed Yemen off. So you have Saudi Arabia bordering the north of Yemen, which clearly is not a friend. And then you have water and then a blockade all around other parts of Yemen, and they have a small border with Oman. And they sealed Yemen off from the world. And they did this because they said that the Houthis were smuggling weapons via ship into Yemen. That's not entirely incorrect. The Houthis were smuggling weapons. And in fact, they've still been able to smuggle weapons with the blockade. But guess what can't come through the blockade? Big tanker ships with fuel and with food. And there's even been cases of the Saudis shooting at aid ships trying to get into the main port in Hodeidah to deliver aid to Yemen. So you've got no healthcare system, an active conflict, a very mountainous country that's very arid, and a completely devastated infrastructure. And now you have a blockade. What do you think happened? There's no food. There's no way to get in the supplies that you need to help people in an emergency situation. And also, it caused an economic crisis. It caused an economic meltdown. So the famine in Yemen is unique, not just because it's caused by a lack of food and an active conflict, but it's also a cash crisis where people have been unable to pay for the food that does exist because it's so expensive, because so little can come into the country because of a blockade. It is a human manufactured famine. It is not caused by drought. It is not caused by some natural disaster. It is entirely manufactured by governments. And they did it to change the Yemeni people, to turn them against the Houthis, when in actual fact, it did the exact opposite, which is why the war in the country is still taking place and why the Houthis have actually gained ground in Yemen and not lost ground, despite all of the fancy weapons that we've sold the Saudis and the UAE, despite the blockade and everything, because people are being starved. The population of Ohio is roughly the amount of people that are in some level of famine right now in Yemen. Okay, so you've got tens of millions of people in a state of famine. And just this week, the United Nations issued an urgent plea saying, because the US government has cut off funding to some agencies of the United Nations who are working in Yemen, is issued an urgent plea for member states to cough up the cash and give them the money, and then for that money to then go to supplies allowed through the blockade into Yemen and be delivered to people who are starving, who are sick. You have pandemic and you've got famine. So I'll stop there because I wanted to make sure I explained the humanitarian crisis taking place in Yemen amid all this stuff. I wish I had like better news for everybody. I mean, the one thing I will say is that this week there was a bill that passed the House of Representatives on Libya. And it's bipartisan. Republicans and Democrats got together and said, hey, we like this bill. They passed it, which was just, almost like an act of God. You don't see too many bills passed these days. And we're very ecstatic about that because it's a very human rights focused bill. And guess what 2 countries are also involved in the war in Libya? Saudi Arabia and the UAE. And so this one deals with their, on Russia has done terrible things in Libya, as it's done in Syria. And Egypt is involved in Libya. So you got all these countries involved in Libya, and this bill essentially punishes people who have been violating the arms embargo, smuggling weapons into Libya, and backing all of these militias who are fighting out to control oil fields, gas facilities in Libya, among other things. I will stop there, and I would love for folks to ask any questions they have. We have about 17 or 18 minutes before I think they kick us out this room. So fire away.
Hi, Philippe. Thank you so much for coming to speak with us. So kind of a broad question. It sounds like it's encouraging to hear that you, kind of Amnesty as an organization is looking to the next administration and is kind of, as they're transitioning, you're also transitioning in how you speak with them. It sounds like cabinet picks are coming out soon, kind of broad strategies of the Biden administration are going to be announced soon. What would be encouraging for you to hear, whether that's cabinet secretaries, whether that's kind of announcements about strategy? What would be encouraging for you to hear as a Middle East specific person in terms of things to look forward to in the next administration? Is it just kind of reversal of things that the Trump administration has done, or are there any specific things that you are looking forward to hearing, kind of, so it's no longer kind of things as usual with regards to the Middle East? Thank you.
I think that's a great question. So, I mean, it's kind of an easy answer. I think that an entirely new approach to the Middle East in North Africa is needed in the Biden administration, and I expect them to largely take that approach. Now, how that shakes out is going to be interesting to see, but I do think there's going to be a couple of big themes that are going to be very, very apparent right off the bat. I think you're going to see a change in the way the United States deals with our allies in the region and holds them more accountable for human rights violations and other violations. So I think that the UAE, Biden has said, he said, I think on a tweet and actually in a statement, that he'd actually may oppose this latest round of arms sales to the UAE, which is significant because, you know, the sale goes through, you still have to manufacture the fighter jets that they're buying, and you have to like manufacture some of the other things that have been put in place. You know, it's not like Amazon where, you know, you put the order in and you're like, damn, I don't want this thing anymore. And you have to like wait till it gets delivered. It's not, it's a much longer window, right? So it's old school, you know, so like they got to make the planes and it's going to take a couple of years. Biden can come in and be like, no, it's not. I mean, there's a little more complicated than that in the sense that there are some, we don't need to go into it, but like some of the companies are actually fronting the money to like manufacture these things until they actually get paid. And so there's like legal stuff, but generally speaking, Biden can make it hard for these weapons to get sent to the UAE. So I think that the United Arab Emirates, I think Saudi Arabia, I think Israel are going to hear from a new tone from a White House that cares about these issues again. We've had, this is not a partisan statement, what I'm about to say, but we have had 4 years of a president that specifically in this part of the world, in the Middle East, North Africa, has told the leaders of this part of the world, do what you want, just keep things quiet. Don't bother me with the nonsense of the region. Like, keep things quiet. We're going to focus on countering Iran, which most of you want us to do. We'll sell you all the weapons you want. We're not going to criticize you for arresting, you know, dissidents and journalists and women human rights defenders like the Saudis have done in a vicious way. We're not going to say anything on that stuff, generally speaking. Just do what you need to do. That's not going to happen anymore. And that is huge because you're going to see accountability. You're going to see a change in the way these countries start talking to the United States and even talking to human rights groups like us. So I do think that's going to be the immediate change, how the Israelis are going to approach the issue of the Palestinians and the occupation in the West Bank and Gaza and all of those sort of issues, right? And their own problems internally within Israel proper. I think you're going to see a change in the way that the Saudis treat their own people. And I think, you know, to the extent that this is like big change or small, depends largely on how muscular of an approach Biden will take to all of this nonsense. And that remains to be seen.
Thank you.
Hi, Philippe. Thank you so much for your talk. It was very informative, and I'm sure we all learned like so much about the humanitarian crisis in Yemen. We have a student that has a question. It's a little extensive, so bear with me. But the question is, the UAE, Saudi Arabia, Egypt, and Bahrain are ruled by authoritarian regimes who have no regard for human rights. Those countries will never change their ways because they never feel the pressure that they have to. The US arms sale to these countries contribute to the atrocities committed by these authoritarian regimes. Since Amnesty is unable to lobby those oppressive regimes, is Amnesty doing anything to lobby Congress to stop supporting dictatorial governments with arms sale and political cover?
That's a great question. It sounds like whoever asked that, I can get them involved in some of our work with Congress. It's a future lobbyist or somebody wants to do some lobbying. So I love that question. So yes, everything is true in that question. These are authoritarian governments that don't really care and have been given political cover by this administration and others in the past to do bad things. I mean, it's essentially, if you could like boil down my like main argument here that I've been making today, it's like largely that. So that leaves civil society groups, human rights organizations, a new Biden administration to sort of turn the tables on these people, right? People have to understand that the United States it's so disliked but so wanted by the Middle East. It's so strange. Like I've spent a lot of time in Lebanon. I'm half Lebanese myself, and in the region. And I was traveling often back and forth, and I'm amazed at the number of people that complain about how terrible the United States is, yet constantly want the U.S. to do everything. But then they don't want the U.S. to do anything, and it's just like schizophrenic, wild. It's the only part of the world where you have like opinion change by the day and by the issue and by the hour, And so like this is one of the things where when it comes to Gulf governments, people want the United States to be very, very vocal and punish the Gulf governments for arresting the women campaigners that led the campaign to drive in Saudi Arabia, when they all got thrown in jail after women were allowed to drive. I mean, literally the same women that were fighting for this are all in jail and have faced horrific abuse. And the United States has said nothing. So like, people want the US to be involved there, but they want them to stay away from Syria, So at the end of the day, my job is to find an opening, like I said earlier on when we first started, and see if there is a bill that we can move in Congress or a sympathetic voice in the US government that will take an issue forward. The issue of arms sales has a lot of sympathy in Congress. The killing of Khashoggi, okay, number one, the arrest of the human rights defenders, women human rights defenders in Saudi Arabia, the killing of an American citizen in Egyptian jail, when we asked repeatedly, or the United States asked repeatedly for this individual to be released. The Egyptians didn't do it, and then he died, and the Egyptians were like, oh God, we messed up, right? All of these things have caused Congress to start to turn, even with all of the lobbying that the Saudis and the UAE and everybody pours into Congress. I mean, I used to go in an office and I would leave and the Saudi team would come in. And they had like multiple firms that they would hire to go and lobby and counter lobby what we were asking for. This is how it is, and with all the money that they poured, public opinion has started to change in the United States. Young people, like all of you on this call, right? People in our generation have said, we don't want to fund this horrible series of abuses. We don't want it. We don't want our name. We don't want to be involved. We don't want the United States to have a little flag on a bomb fragment that killed a whole bunch of kids in Yemen. We're not interested in that. So like the same folks that fought against the Iraq war are now involved in lobbying to stop selling weapons to the UAE and Saudi Arabia. So 2 times in the last 2 years, we passed a bill in the House and the Senate, bipartisan, that called for an end to arms sales to Saudi Arabia and the UAE. If you had asked me 5 years ago, would that ever be possible? I would have laughed like, I would have laughed like the hyenas in Lion King. I mean, I would have been like on my side laughing, cackling. I mean, it's just like, it's inconceivable that that things have changed so much because of public opinion in the US and the whole US Congress, Democrats, Republicans, I mean, not the whole, but the majority were able to pass these bills saying no more. And we were only a few votes short of overriding a presidential veto. So Trump vetoed it because he said, we're selling these weapons. He vetoed it and killed it. And he can do that. You have to have a certain number of senators to override a veto. We got close, we didn't get to that yet. So you're gonna see that in the next couple weeks before the end of the year, where there's going to be a big fight in this Congress to pass bills that just got introduced on Thursday of last week. So it's a very timely conversation. And if you'd asked me that this would be happening 2 weeks ago or 3 weeks ago, whenever I agreed to talk to all of you, maybe even 4 weeks ago, I would have said, no, I have nothing for you guys to do before the end of the year. And now look what we got. We've got a whole other round of weapons being sent to the UAE and a bill that would actually halt those. Can we get enough votes this time to override a presidential veto? I don't know. So to answer the question, there are bills that exist that are human rights focused that have massive impact. And we didn't have those before in the past, but we have them now. And it's because the advocacy community has gotten very organized and very involved in ending the war in Yemen and or the suffering of the Yemenis and all of the other violations that have occurred, at least under President Trump's watch, that the US has been complicit in. So there's a lot of opportunities to be involved. I'm gonna put my email in the chat here for folks to email me if you want to talk about a career in this field, if you want to talk about how you can lobby the next 2 weeks and call your senators and members of Congress. I can walk you through that. We would all love your help. And so I hope that I get a few emails from you at least. So.
I have another question from a different student who wanted me to read it. Last year, the Trump administration stated that it is now guarding and controlling the oil wells in northern Syria. Independent reports suggest that the US is extracting the oil with help of terrorist organizations such as the PKK. This is the only oil that the Syrian people have, and we do not see anyone holding the US administration accountable. The oil money should be spent on rebuilding Syria and feeding those displaced. How can we hold the Trump administration accountable for stealing Syrian oil?
So that's an interesting question. There are a few things that are incorrect. Essentially, yes, Northeast Syria is under the control of a variety of like Kurdish Arab groups or Arab/Kurdish groups that are supported by the United States to a certain extent. And they are present over a good chunk of Syria's oil reserves, which aren't very extensive, by the way. It's not like a Libya or other countries. It was never a really big oil producing state to begin with. However, the Syrian government, the very one I spent time talking about, that is just has honestly will be found guilty of committing some of the worst atrocities that the world has seen since the Holocaust, hands down. Documented. Meaning we saw in live action from satellites, 11,000 people hanged over the course of a year in the Sidnaya prison in Syria, where they built a crematorium to hide the, I mean, like we watched, we as in the world has been able to see what has been happening in Syria in live real time. You know, and you can't say the same for other conflicts that happened before, which is why I say this may be the most documented, obvious, systematic, you know, killing of people that we've seen in a very long time. That government wants that oil because they're under sanctions and are desperate to survive. And so it's a very, very tough, and this is a presentation in and of itself, is how do you hold a government like that accountable for the violations it's committed without invading and removing that government or arming groups that are trying to remove that government, which the US did do under Obama, by the way. It didn't really work for a variety of reasons. and you have the ability to control areas that would only strengthen the government and give it more money, not to feed people, but to buy more weapons to kill people. So how do you, as a policymaker, and like this is like an exercise that we could all do here if you want to game this out, is like how do you come up with a solution where you release these oil fields or areas where people grow food and everything to this government, and then know what they're going to do with the money? That's hard. It's hard to make that decision. And Amnesty is not a part of that decision-making process. We're not here to say that the U.S. should stay or U.S. should go and whatever. We just want human rights abuses to end, whether it's in Northeast Syria or in Syria proper. That's all we really do. But it's much more complicated than just the U.S. stealing oil. The U.S. doesn't need Syrian oil. We have a ton here in the United States. We're one of the top oil producers in the world now. I mean, we don't need Syrian oil. Syria needs Syrian oil, but the United States doesn't need Syrian oil. So that's not correct. However, the issue in and of itself is very complicated and problematic, and a much longer conversation. So I'm hoping I kind of answered that question and kind of like corrected it, but that's essentially what we have right now in that part of the world.
I have a question to kind of bring us back a little bit. So in thinking about our role as medical students and, what role, we could have in advocacy in these very, very complicated, very, very nuanced conflicts, what role would you like us to play in, advocacy in the region? Oh, I'm realizing we have no time for this question.
That's okay.
But whatever you can.
I can answer this. Yeah, look, like I actually think that some of the best advocates on humanitarian issues are students who are studying medicine or are practicing medicine, okay? I think that, when you go in a congressional office and you say you're a medical student that cares about the famine in Yemen because you know what hunger can do to the human body, it's so much different than if you're like this like peace activist who does this with every conflict. And I mean, those people are wonderful, but there's a little bit more of an impact. It's different, on policymakers when you're a future doctor that they're going to go see when they're not feeling well or whatever. It's like there's something personal about it, and it's very powerful. And I encourage all of you to really harness that power and make a very positive.
Okay. What is it?
My email?
Yeah.
Oh, I can send another email to you right now.
No, I got it, but I just put it, I saved it. I'm trying to find it.
Yeah, S-H-A-J. I'll put it in the chat as well.
S-A-H-J. I got it.
Oh,
Yeah.
you got it. Oh, perfect.
I got it. Okay.
Great. Okay, so Joanne and Philippe are back, and I want to give you a chance to just address everybody. I was here managing the main session, but I was getting a lot of text messages about how great the sessions were. So go ahead, and thank you for joining us.
Thank you for having us. I mean, I was just sort of, I had this wonderful question the last 60 seconds, and I was like nervously answering as the clock was ticking, about how you all as future medical professionals and students can have an impact. And I was just saying, and I can say this to everybody else as well, there's something so powerful. If you're a future doctor, a physician or whatnot, that goes into a congressional office or gets on the phone with a congressional office and lobbies on an issue like the humanitarian crisis in Yemen, and you can explain what hunger can do, persistent chronic hunger can do to the human body. It's different than when I go in and talk about it, or when other activists go in and talk about it. You connect with them on a very personal level where they see in you a future doctor that they can go visit when they're sick, or when a family member is sick. Like it's very relatable to anybody, regardless of the political party. So I think that was a great question. I think to everybody else here, that joined today, harness that energy. It is a very, very potent, powerful tool that can be used in advocacy to do a lot of good. And I've been in just dozens and dozens of meetings. I mean, this year alone with activists, and hundreds in my career. And anytime I have somebody who is a future medical professional, they really tend to resonate even more deeply than other people. So I encourage everybody here today to take what you learn and then use that to the fullest extent.
We had a similar discussion in our session, and I said, unlike Philippe and I, you folks have the luxury of sounding non-political, non-partisan, that you really are the medical experts, and you're here to provide your medical expertise to lawmakers and policymakers. I have seen this make a tremendous difference on several fronts. So for instance, with respect to this administration's very controversial family separation policy, the process of actively separating children from their families as they're arriving at the southern border. I mean, that was offensive in so many different ways, but where we saw some traction actually made was when medical and mental health experts actually spoke out publicly about what are going to be lifelong consequences to these children, even the children who have eventually been reunited with their parents. And as we know, there are hundreds of children who now, years later, have still not been reunited with their parents. And so that is an undeniable fact, even for those Republicans who defended that practice or even advocated for that practice. It is an undeniable fact that the practice of family separation is going to cause lifelong, permanent medical and mental health damage to these children. We talked about this in the context of Uyghurs and Turkic Muslims in Xinjiang. And even though in all likelihood, most of us won't be able to get into Xinjiang or into those mass detention camps, although I do think it is really important for like the International Committee for Red Cross and other medical groups to seek and to push for access to those mass detention camps. I do think that there is a role to play for PHR and for medical students to interview the Uyghur diaspora here in the United States and around the world. These are people who have loved ones, family members who are basically missing. And I think it's important to document what are the long-term mental health impacts of having a sister, a father who is detained for years on end, no word about their situation, their whereabouts, or even if they're alive. And that is the experience of Uyghurs around the world. And then put on top of that, the additional information we have about Chinese consulates and embassies actively contacting diaspora from around the world, asking, what are you up to? Who are you consorting with? Where are your whereabouts? Like that kind of surveillance from the Chinese government, even when you're living in Houston, Texas, that is something that I think the medical community can help research and document and put into medical terms. So I just want to thank all of you for, obviously you're working tremendously hard to prepare to become doctors. And then the fact that you would take a Saturday afternoon to hear from Philippe and me about human rights crises around the world. I mean, I'm heartened by this because I really do believe that you folks are the future. And, in this next week or so, Biden is going to announce his top level cabinet secretary nominees. And I think besides the Treasury Secretary, the top two are going to be HHS and the Secretary and the Surgeon General. And I would expect both of those nominees to be medical experts, doctors. And so I think, sadly to say, the time has come for more medical experts to be leading our country through this pandemic and through other human rights crises. And I'm confident and hopeful that some of you will have a role to play there. So thank you for inviting us.
And I put my email in the chat for folks that want to get in touch, want to be involved, want to do some lobbying, we have opportunities right now, actually, this coming week on arms sales the week after. Or just to talk about, you know, what it's like working in this field. I'm always happy. I in fact love and cherish when people reach out to talk about those things. So please do.
Thank you both for joining us. And before you go, I just want to thank, she's not here right now, she's out of the country, but Naushin Islam, who is the one that actually connected us to you, to Amnesty International, because she's been involved. I think you both know her. She's completely amazing. She's not here right now, but if not for her, we would not have had two amazing people join us. And thank you so much for just inspiring all of us with your sessions. It was so interesting. I mean, I wasn't there, but I was getting all these text messages from people. So thanks again for joining us.
Thank you. Take care.
Take care. Thanks. All right. And we're just only at about 6 or 7 minutes, running a little late, but we have our panel now, which is going to be moderated by Susanna Sirkin, the wonderful Susanna Sirkin, who is a senior advisor and director of policy at PHR, and she's moderating a discussion with, I'll let her introduce the panelists, but it's on attacks on healthcare and COVID-19's impact on global healthcare systems. So I'm going to hand it off to Susanna.
Thank you so much, Sebastian. And I just want to reiterate what our two previous speakers said, which is, and I've seen it also, the power that health professionals can have, medical students, doctors, nurses, psychologists, public health experts, when you go and advocate. And in this domain that we're about to enter into,